Hello everyone, and welcome back to another eClinical Works tutorial video. Today we'll be going over referrals, both outgoing and incoming. So here we are on the Patient Hub screen of a test patient, and we're going to go over to the left side here because that's the easiest way to get to referrals. In this column, it's right here, right underneath immunizations and right over allergies. Let's go ahead and press that. And here we are in their existing referrals. So currently we're under incoming, and this is an existing incoming referral. We're going to start with outgoing, and as you can see, this test patient has been used a lot. We're going to ignore these and make our own. So we're going to go to new. And so here we are with this new test patient. So luckily, most of the important things are already starred for us, so we know what to look for. So here's our provider from Essen at this location who is referring this patient to such and such specialty. So let's go ahead and pick a common one like endocrinology. You can but do not have to pick one of the facilities. Make sure it's assigned to somebody. And then from here, you will do things like make sure the dates are correct and so forth. Those are straightforward. Other reasons or other things to not forget are reasons. So let's go ahead and do something straightforward. Okay. And then the diagnosis code will be down here, in which case you add in a pretty straightforward way with our ICD codes. So we're going to stick with the same theme. And here we go from there. Now, most of what has been accomplished on this particular page is already done, but there are a couple of other things that shouldn't be forgotten. So, visit details is a pretty important page because here you have to make sure to standardize. For everything except physical therapy, you should put 6 visits allowed. For physical therapy, it should be 10 visits allowed. Sorry. And then make sure to name these different encounters. So, going to work with our test patient here. And just assign these. That is if you don't have other dates in mind. So keep that in mind as well. Now, we're not quite done yet. There's still another tab over here that we need to look into, and that's notes. For notes, it's important to timestamp over here. What does that mean? Well, here we are. There's a little clock, and when you press on it, the person doing the note will have an automatic time and date stamped for that person when they are making this note. And then you'll have to add a message afterwards. Now this can be something pretty straightforward. For example, and that can usually suffice. And then once you're done, it's important to label it as addressed. Another important thing to check for is to make sure that whichever provider you are choosing does in fact accept the insurance. And that can be done over here with these 3 little dotted lines over here. And you can choose a provider. So I'm going to choose an endocrinologist that we have here. And that can be done. However, that's actually incorrect. What you want to do is make sure that they accept the insurance. So what do? We go to accept patient's insurance. Now let's see if the same provider is available. And they are, so that's good. So we'll stay with that same provider. Now, before we leave the outgoing referral, there is one big caveat that we need to think about, and that is patients who are seeking an outside physician that's not affiliated with Essen, because that does require a few different things for us to do. So, first of all, that is called a blank referral. So, it's important to notify that here. But there's a few other things that need to change also. For example, assigned to requires a very specific assignment, and that is the Department of Outgoing Referrals. If you don't click that, then you will not be able to send the patient out, and you'll have to deal with the patient in at Essen. After you've made sure that the specialty is correct, that the diagnosis code is put in, and that the message is added, you can go ahead to Attachments. See, we have to save this before we can attach, let's say, a progress note or something of that nature, and we can do that. So let's see if we're able to add something. I guess on a test patient it's a little harder, but that is where you would go ahead and do it. And then you would go ahead and send the referral. And from here we get this screen, the send referral screen, and you have several options. So you can print, print with attachment, fax, or fax with attachment. So we're going to avoid actually sending this out so we don't send a referral. And see, if you did a referral and you've gone through the motions, this screen should pop up so that way you have the option to save or to not save. Now, similarly, an incoming referral can also be done, and we're going to do a new one of those. And by and large, it's fairly similar. So the things that are starred are the most important. We'll have a provider. In this case, we'll be focusing more on from. And let's just pick a facility. And then it will be going to such and such provider, in this case at Essen, so we keep things simple. Make sure it's assigned correctly. We'll use the same reason as last time. And you can use a diagnosis code again because that's important. And so just to run down what you would expect to do for an incoming referral, make sure that there's a provider, specialty, and facility for going to. And from a provider and facility, make sure that it is assigned to the correct person, that the start and end date are correct. Make sure the reason and the diagnosis are right. Check the visit details. Make sure to go through the same motions as before. So again, 6 versus 10, for example. For notes, make sure to stamp it and then add your reason, whatever that might be. If an authorization code is needed, then make sure to do that and then press OK as well. And see, that's what it's going to come up as. So the incoming referral will not necessarily always show on this list. In this case, it did, but sometimes it will not. So just keep that in mind. So just to quickly go over some of the higher yield points from this video, make sure that the allotted amount of referral visits is 6, unless it is for PT, in which case it is 10. Make sure that a referral has the patient contact info, insurance, diagnosis code, and reason. Referrals are electronic documents that provide the users with a request of consultation for a specific specialty. And there are 2 types of referrals, both incoming and outgoing. So hopefully this has been educational for you. Thanks for sticking around and listening to the end. And we'll see you next time.